Hi everyone, my name's Amita Aggarwal, and I am one of the Chief Pharmaceutical Officer's Clinical Fellows at Health Education England, and I'm a pharmacist by background. So I've got a presentation which I will just share now, and it's about pharmacy as a career. So I'll just be talking about the pharmacy team, who makes up that team. Like to reflect on your thoughts. I'll be doing a bit of myth busting on pharmacy, the wide range of opportunities that are available to you. And then I've left the least interesting bit to last, which is a brief slide just about me and into my career pathway. So in terms of the pharmacy team, so some of you may or may not know this, but there's three kind of distinct groups that make up the pharmacy team. So there's pharmacists, pharmacy technicians, and pharmacy support staff. And they're all really integral in the pharmacy team, but their pathways are slightly different. And actually, they're each geared to people who might want to take a slightly different career journey into each role. So if I start with pharmacists first, so pharmacists really sort of advise patients on minor ailments, so such as coughs and colds. They can help patients manage long-term conditions, and they really kind of check medication for safety, appropriateness, and clinical effectiveness. Many pharmacists are independent prescribers, and they're responsible for assessment and decisions about the clinical management of patients. And if you wanted to become a pharmacist, at the moment, it's a 4-year master's degree at university plus the 1-year placement. As I mentioned, pharmacy technicians are integral in the pharmacy team, and their role is to really engage with patients, offer advice and treatment options. In hospitals, you might be involved in taking medicine histories from patients and giving advice. Also, we're managing the supply of medicines and liaising with other members of the healthcare team. If you wanted to become one, usually you would find employment as a pre-registration pharmacy technician. You then usually have on-the-job training for about 2 years, where you will end up completing a national qualification, which consists of 2 parts. First being a level 3 MVQ diploma in pharmacy service skills, second being an accredited underpinning knowledge course. So that's really the journey to becoming a pharmacy technician. And both pharmacists and pharmacy technicians are registered professionals with our regulatory body, which is the GPHC. Another integral member of the pharmacy team is pharmacy support staff. And what do they mainly do? They mainly help with dispensing prescriptions, ordering stock, also selling over-the-counter medicines. So some of you might have already encountered pharmacy support staff, as well as the others. If you were interested in this career pathway, you can go into work at any stage. So you can go straight into work, and you'll receive sort of training whilst working. And be enrolled in a training course working towards a nationally recognised pharmacy service qualification. So I just wanted you to take a couple of minutes just to reflect on your thoughts. And actually, when you hear the word pharmacy, what words spring to mind? So if you've got, a piece of paper next to you, just scribble down some words, or just reflect in your mind what sort of words come to mind when you think of pharmacy. And that brings me on to the next slide, which is I wanted to create a bit of myth busting. And actually, these are some words that I've heard of being associated with pharmacy. Some of those include pharmacists only work on the high street. The role of the pharmacist is to pick medicines from shelves or just give out medicines or stand behind the counter. Some people think that the job's not varied, it's boring, it's stressful. No progress in the career, or similar to a shopkeeper. And as I've put in the centre, this is in fact fake news. And actually we work in a variety of settings, and I've got a slide later that covers that. In terms of picking medicines from the shelves and giving out medicines, that is a part of our role, to supply medicines to patients, but actually it's a fraction of the role. And as a pharmacist, we're really responsible that the medicine is it's the right medicine. So there's hundreds and thousands of medicines, and it can be really confusing as different medicines work for different conditions. Some medicines are better than others, some change how they work depending on other medicines the patient's taking. So it's really our job to make sure that patients get the right medicines for them. Second being to make sure that it's the right dose for the patient. So as you can imagine, that could depend on age. For example, you wouldn't give the same dose of a medicine to an adult as you would a child. And the third part of our role is really crucially to make sure that we supply the medicine at the right time, so that patients continue to receive essential treatment, especially when they're on complicated regimens. So what do we do? And I've listed it as the truth. So as I've sort of already touched upon before, we're experts in medicines, we're experts in the safety of medicines, and a lot of our work, especially in a community setting, is around minor ailments. We're also a critical part of the multidisciplinary team. So we work with a huge range of healthcare professionals, doctors, nurses, dietitians, amongst others. And really what we do as part of this multidisciplinary team is really advise our team. So for example, we might work with doctors to advise them on treatment options that are best for the patient, taking into account the patient's preference, different conditions that they might have, and their demographic. A crucial part of our role is also to provide healthy living and lifestyle advice. So for example, we can help patients stop smoking through sessions where we gradually decrease their nicotine strength. And we can also support them and help them with some of the withdrawal symptoms that you get from this. We also very much have a patient-facing role. So for example, where there's clinical pharmacists and GP practices, some of the things that we might do are we might run our own sessions. And actually, if we're reviewing a patient that's got high blood pressure, we might take their blood pressure, monitor it, and then adjust their therapy appropriately. So that might be increasing or decreasing the strength of their medication that they're on. So where do we work? Essentially in a huge range of places. So we work in hospitals, we work in GP practices, we work in industry, so those pharmaceutical companies that you've probably heard of. We work in technical services, so that's things such as aseptics, where we manufacture chemotherapy for patients. A huge amount of us work in research. We also work in remote services, so that's services such as NHS 111. We work in academia, so that's at universities, and a lot of us have a teaching role as well. We work in care homes as part of a multidisciplinary team to provide care for patients that are in the care home. We work in a community setting, so they might be pharmacies that you find in your local high street, for example. And we also work in mental health, so for example, mental health hospitals as well. So as you can see, we really work in a huge range of places. So what are the opportunities if you decide to pursue a career in pharmacy? Well, I think there are just so many opportunities, and that's what makes it such an exciting career. So some pharmacists take up specialist education and training roles or become teacher practitioners. Digital transformation and clinical informatics is a huge area of development. Pharmacists might be involved in developing and maintaining a wide range of systems. For example, dispensing robots that can scan product barcodes, which are then linked to medicines that are administered on a hospital drug rounds. There's so much going on the digital transformation forum. Pharmacists can also get fellowships, and that's something that I'm on at the moment, and I'll talk a bit more about that in the next slide. You can also enhance your clinical skills. So some pharmacists go on to study further and become an advanced clinical practitioner or an ACP, where they might complete some physical examinations, interpret tests, and diagnosing and treating diseases and illnesses. And they usually work in urgent care. Pharmacists can also progress to work as consultant pharmacists in specialist areas, which is so exciting for us as a profession. We also have a huge range of leadership and management opportunities, and pharmacists might aspire to become chief pharmacist in a hospital or superintendent pharmacist of an organisation. Alternatively, you can work at national organisations such as Health Education England or NHS England and Improvement, leading on change or being responsible for delivering a programme of work. So as you can see, the opportunities are so vast and so endless. So if I move on and talk a bit about me, and I must admit I'm probably not as cool as the blue person that I've put on the slide, but I'll just talk through a bit more about me and my journey and where I've got to now. So I studied a mixture of science and maths A-levels at school. Alongside that, I had a part-time job working as a member of a support staff at my local pharmacy. And actually that triggered me into thinking that it's a career that I would like to pursue. So I went to university and studied for my pharmacy degree. I then pursued a career in hospital pharmacy, where I worked through rotations in hospital, such as general medicine, AAU, which is the acute admissions unit, care of the elderly, surgery. So I really expanded the different roles and rotations within the hospital. After I had done that and gained some general experience, I then decided to work in aseptics, which was really exciting, and that's the technical services aspect. And we worked to manufacture chemotherapy. So chemotherapy needs to be manufactured in a sterilised environment. So I did get to wear the funky suits, which covered me from head to toe, so you don't contaminate the room where chemotherapy is made. And chemotherapy is very much tailored to patients, and it's made on a one-to-one basis in hospitals. So it's something that requires a great attention to detail, and was really exciting. I then moved on and rolled out electronic prescribing at the Trust, and took a project role in automation and robots. So very much what I was talking about before about digital transformation being such an exciting area. And actually there's so many developments in pharmacy and how that's coming about. And that's led me into my current role, which is, as I mentioned before, one of the Chief Pharmaceutical Officer's Clinical Fellows at Health Education England. And really my role at a national organisation is that I'm part of a team that looks at the people training to be a pharmacist or a pharmacy technician. And really we look at the direction of travel, how we can support people who are training to be pharmacists or pharmacy technicians, so that really we can provide the best care that we can to patients. So lastly, if you're wondering if pharmacy is a career for you, I would say that if you're interested in science, if you're interested in health, if you want to care for people, if you want a career that has a huge range of opportunities and is such an exciting and diverse career, then yes, then pharmacy could be a career for you. So thank you very much for listening, and it's been a real pleasure sharing some insights today.